Hello, I am Ankita Tiwari, research scholar pursuing PhD from Department of Pharmaceutical Sciences, Dr. H.S. Gaur University, Sagar, with an interesting and learning episode of antitussive agents including Introduction to Antitussive Agents, Centrally Acting Antitussives, Opium alkaloids and their modifications, Synthetic antitussives, Peripherally Acting Antitussives and Expectorants, which is one of the important units of section of B.Pharm 5th semester. This presentation is prepared by Dr. Sunil K. Jain, Professor and Director, Adina Institute of Pharmaceutical Sciences, and Mohammad Hashim Mansoori, Associate Professor, Adina Institute of Pharmaceutical Sciences, Sagar. Let us start our episode while taking a look at what we are going to learn today. Module 1. Introduction to Treatment of Cough. Expectorants, Antitussives. Module 2. Peripherally Acting Antitussives. Module 3. Centrally Acting Antitussives. Module 4. Opium alkaloids and their modifications. Module 5. Synthetic antitussives. Let's start with general introduction about cough and its treatment. Module 1. Introduction to Treatment of Cough. Cough is a protective physiological reflex by which foreign substances, irritants or obstructive material and mucus are discharged from the respiratory tract. It is very extensive and commonly ignored as a mild symptom. Cough is a useful physiological mechanism that serves to clear the respiratory passages of foreign material as well as excess secretions and should not be suppressed indiscriminately. Although cough is a valuable physiological function, but if it becomes too severe or too frequent or non-reproductive with pain and fatigue, then it should be controlled. Mechanism of cough production. The cough reflex is a complex phenomenon involving the central nervous system, that is CNS, peripheral nervous system, that is PNS, and smooth muscles of bronchial tree. It involves following events. The cough receptors lie in the mucosa of the bronchial tree. Afferent conduction of impulses from these receptors via the vagus nerve, the central afferent impulses pass to the medulla. Then, an autonomic sequence of events is triggered by medulla, which results in cough. Types of cough. The cough can be categorized in different types. First, productive cough, that is cough with excessive secretions. Second, non-productive cough, that is cough with no secretions, that is dry cough. Further, on the basis of duration, characters, quality and timing, the cough may be acute, which is sudden onset or less than 3 weeks, subacute, that is 3 to 8 weeks, or chronic, longer than 8 weeks. In such cases, the physician recommends the use of antitussives and expectorants. These agents are used in the symptomatic control of cough and act by depressing the cough center located in the medulla as well as affect various regions of the tracheo-bronchial tree. Now, we take a short review of expectorant, then we will focus on antitussives. Expectorant. The word expectorant is derived from Latin word expectorare, which means to expel from the chest. An expectorant works by signaling the body to increase the production of respiratory fluid that cover and protect the irritated mucosa and facilitate the removal of respiratory tract secretions by coughing. Expectorants, more accurately known as bronchomucotropic agents, are drugs which assist in the removal of secretions or exudates from the trachea, bronchi or lungs. They act by liquefying viscid mucus or mucopurulent exudates. In other words, these are decongestants. Therefore, these are used in the treatment of cough by expelling the exudates and secretions. Expectorants can be divided into groups like sedative expectorants and stimulant expectorants. Sedative expectorants. The drugs of this group help specifically in the secretion of a protective mucus film which covers up inflamed membranes and increases the efficiency of the removal of slimy exudates by coughing. Sedative expectorants may further subdivided into 3 different classes. First, saline expectorants. They are used to soothe the inflamed respiratory mucosa by stimulating the secretion of protective mucosa. that is by secretory cells of the respiratory airway, so increasing the fluidity of sputum and help expectoration by cough. Example, sodium chloride, potassium chloride, potassium citrate, potassium acetate, ammonium chloride, etc. Second is nauseant expectorants. These act as expectorants in small doses and nauseant and emetic in large doses. Example, tartar emetic, ipecac, etc. Third is demulcent expectorants. These agents are normally mucilaginous in nature and serve to coat and protect the mucous membrane of the upper respiratory tract. Example is licorice, tolubalsam, vasaca, etc. Few examples belonging to sedative expectorants are: first, sodium and potassium citrate are considered to increase bronchial secretion by salt action. Second, potassium iodide is secreted by bronchial glands and can irritate the airway mucosa. Prolonged use can affect thyroid function and produce iodism. Now it is rarely used. Third, guaifenesin, vasaca, tolubalsam are plant products which are supposed to enhance bronchial secretion and mucociliary function. Fourth, acetylcysteine. It can be synthesized by carrying out the direct acetylation of naturally occurring L-cysteine. Uses: acetylcysteine reduces the viscosity of pulmonary secretions. Lowering of viscosity of the mucus may be due to the opening of the disulfide bond present in the sulfhydryl moiety in the mucous medium. Usually, it is incorporated as an adjuvant in the preparations meant for bronchopulmonary disorders when mucolysis is required. Stimulant, that is irritant expectorants. They stimulate healing and repairing of chronically inflamed respiratory mucosa, decrease the amount of sputum, and sputum loses its objectionable odor. Example, terpene hydrate, guaifenesin, that is robitussin. Guaifenesin. For the synthesis of guaifenesin, guaiacol is used as a starting material. Action and uses. Guaifenesin is an expectorant. It may be useful in the symptomatic relief of dry, non-productive coughs and in the presence of mucus in the respiratory tract. Usual dose. It is 5 to 20 ml at every 4 to 6 hours. Now we will focus on antitussives. Antitussives are the drugs which are used in the treatment of dry cough by suppressing it, that is, reduce the input of stimuli arising from pharynx, larynx and trachea. The cough reflex is complex, involving the central and peripheral nervous systems and the smooth muscle of the bronchial tree. It has been suggested that irritation of the bronchial mucosa causes bronchoconstriction, which in turn stimulates cough receptors, that is special type of stretch receptor located in tracheobronchial passages. Several compounds have been synthesized that possess antitussive activity without the addiction problem as seen in the narcotic agents. Along with other ingredients, many cough preparations containing antitussive agent including antihistaminics, which are when cause of the cough is allergy. Some antihistamine drugs like diphenhydramine have both central antitussive as well as sympathomimetic actions. Antitussives specifically inhibit or suppress the action of medullary center or associated higher centers by increasing the threshold of the cough center, interrupting of peripheral impulses in the respiratory tract and inhibiting the conduction of impulses along the motor pathways. Classification of antitussives. The antitussives can be classified as: first, peripheral antitussives. They have soothing effect on the irritant mucous membrane, example, licorice, steam inhalation of benzoin tincture, composite and menthol. Second, central antitussives. They inhibit the cough center and may be narcotics or non-narcotics. A. Narcotic antitussives. Examples are hydrocodone, morphine, hydromorphone, methadone and levoferon. Codeine and morphine have antitussive, analgesic, euphoric, respiratory center depression and dependence activity. Folcodeine and hydrocodone have weak addictive, analgesic, euphoric and respiratory center depression activity. Morphine and related opioids depress the cough reflex at least partly by direct action on a cough center in the medulla. There is no obligatory relationship between depressions of respiration and depressions of coughing. Some available antitussive agents do not depress the respiration. Suppression of cough by such agents appears to involve receptors in the medulla that are less sensitive to naloxone than those responsible for analgesia. B. Non-narcotic antitussives like noscapine and dextromethorphan, devoid of analgesic effect, dependence, euphoria, and respiratory center depression. Dextromethorphan, that is D3-methoxy-N-methylmorphine, is the dextroisomer of the codeine analog. Methorphan, unlike the levoisomer, it has no analgesic or addictive properties and does not act through opioid receptors. It centrally elevates the threshold for coughing. Its potency is nearly equal to that of codeine, but it produces fewer subjective and gastrointestinal side effects. In therapeutic doses, the drug does not inhibit ciliary activity and its antitussive effects persist for 5 to 6 hours. Its toxicity is low, but extremely high doses may produce CNS depression. Third is central and peripheral antitussives. They suppress cough center by inhibiting the pulmonary stretch receptors, example benzonatate, which is related to the local anesthetic tetracaine. It anesthetizes the stretch receptors in the lungs, thereby reduces coughing. Adverse reactions include hypersensitivity, sedation, dizziness, and nausea. Dear friends, till now you have gained a complete idea about antitussive agents, centrally acting antitussives, opium alkaloids and their modifications, synthetic antitussives, peripherally acting antitussives and expectorants. If you have missed any of the module or content, you may log on to our website, that is www.cec.nic.in, to download the videos, FAQs, LOR and other contents so that you can remain updated with this chapter. Now let's move ahead to our next module, that is about peripherally acting antitussives. Module 2. Peripherally acting antitussives. Peripherally acting antitussives act through inhibition of cough receptor or pulmonary stretch receptor. The anti-cough effects can be achieved by the inhibition of cough receptor of pharynx, which is by the use of demulcent and soothing pastilles and gargles; larynx, by the use of emollient and soothing spray of menthol and eucalyptus; tracheobronchial airway, by the use of inhalation of hot steam medicated with benzoin tincture. According to the way of exerting antitussive action, these agents can be grouped into the following classes. First, inhibition of peripheral cough receptors. This class includes several local anesthetics or related drugs. The prototype is benzonatate, which is also a central antitussive, but other related compounds like aloclamide, oxalamine and prenoxdiazine act in the same way. Benzonatate, chemically related to the local anesthetic tetracaine, was a result of planned search for more specific antitussive agents based on the rationale that they could be found among compounds having a local anesthetic moiety combined with a substance having selective affinity for myelin. Benzonatate restrains cough center through pulmonary stretch receptors. It anesthetizes the stretch receptors in the lungs, thereby reducing coughing. Adverse effects include hypersensitivity, sedation, dizziness and nausea. Second, demulcents. Demulcents, also called emollients, are substances that act by protectively coating the irritated mucosa and by stimulating the production of saliva, and very likely by exerting a mild anesthetic action. They are used mostly as vehicles for the more specific antitussives. Examples of demulcents include acacia, glycerine, glycyrrhizin and honey. Third is mucolytics. Mucolytic agents have been useful as antitussives because in irritative states there is an increase in concentration of mucoproteins and mucopolysaccharides, which are the main constituents of normal respiratory tract secretions. Apart from these, some other agents also work as antitussive agents like A. Detergents, example polysorbate; enzyme, example chymotrypsin, pancreatic dornase and trypsin; Cysteine derivatives, example acetylcysteine, nisostine and prenistin. Miscellaneous agents, example adamixene, ambroxol, amifostine, bromhexine, saline solution of water, etc. Module 3. Centrally acting antitussives. These drugs reduce cough as a result of their central action. They depress the area of the CNS which controls the cough reflex. They are mainly useful in the symptomatic relief of dry irritant type of cough. They may be narcotics or non-narcotics. Opium alkaloids, morphine, codeine. Derivatives of opium alkaloids, for example, folcodeine, ethyl morphine or noscapine. Synthetic morphine substitutes, example dextromethorphan, levopropoxyphene. Non-opioid synthetics, for example, caramifene, dimethoxanate, chlorpheniramine. Module 4. Opium alkaloids and their modifications. The naturally occurring alkaloids in opium with antitussive activity are codeine, that is antitussive of choice, morphine, mostly used as analgesic, and noscapine, that is tuscapine. Codeine. It is an alkaloid that occurs naturally in opium codeine. Chemically, codeine is 7,8-di-dehydro-4,5-epoxy 3-methoxy 17-methyl morphinan 6-ol. Synthesis. Codeine is an alkaloid obtained from opium 0.7 to 2.5% or prepared by methylating the hydroxyl group of morphine with methyl iodide in potassium hydroxide. Properties. Codeine occurs as odorless, colorless, crystalline powder. It is levorotatory compound and is slightly soluble in water. It should be kept in a well-closed, light-resistant container. It is also available as colorless, water-soluble hydrochloride or phosphate salts. Mechanism of action. Codeine acts by the inhibition of CNS medulla-mediated cough reflex. Uses. Codeine has been used for pain relief and suppression of cough. Codeine has a reputation as an antitussive, depressing the cough reflex, and is used in many cough preparations. It is one of the most widely used morphine-like analgesics and less addicting than morphine. Morphine. Morphine is obtained only from the opium poppy, Papaver somniferum, either from opium pod or from poppy straw. The free alkaloid occurs as levorotatory, odorless, white, needle-like crystals possessing a bitter taste. It is almost insoluble in water at the boiling point, ether or chloroform. It is somewhat more soluble in ethyl alcohol. It shows potent analgesic activity towards all types of pain and causes addiction so readily. It controls pain caused by serious injury, neoplasms, migraine, pleurisy, biliary, renal colic and numerous other conditions. Module 5. Synthetic antitussives. Dextromethorphan. It is a synthetically produced substance that is related to codeine. Chemically, it is 3-methoxy, 17-methyl, 9-alpha, 13-alpha, 14-alpha morphinan. It has central cough suppressant action, but it does not show the untoward effects of opioids. Its metabolism is genetically polymorphous, similar to the codeine metabolism. According to more recent studies performed predominantly on animals, it has anti-epileptic, neuroprotective and anti-Parkinsonian properties. Properties. It is white-colored, odorless, solid crystals or solid powder. It is soluble in water 1.5 gram per 100 ml, soluble 1 in 10 of ethanol, freely soluble in chloroform and practically insoluble in ether. It should be preserved in airtight and light-resistant containers. Uses. It is used in cough or cold preparations as an antitussive, not with expectorant. Benzonatate. Structurally, benzonatate is related to tetracaine. It is a non-opioid synthetic antitussive drug. Benzonatate anesthetizes the stretch receptors in the respiratory areas, dampening their activity, reducing cough reflex. Noscapine. It is a phthalate isoquinoline alkaloid obtained from plants of the Papaver genus of family Papaveraceae. Chemically, it is 3s,6,7-dimethoxy-3,5-R-5,6,7,8 tetrahydro 4-methoxy 6-methyl-1,3-dioxolo, 4,5-G isoquinoline, 5-yl phthalate monohydrochloride hydrate. Noscapine is an antitussive agent acting on central nervous system. It also possesses weak bronchodilator properties. Noscapine lacks addictive, analgesic, respiratory depressant and sedative properties. Caramifen. It is a non-opioid synthetic antitussive agent. Caramifen is less active than codeine but has longer duration of action. Caramifen can be synthesized from phenylacetonitrile as phenylacetonitrile on double alkylation with 1,4-dibromobutane gives substituted cyclopentane derivative, which on hydrolysis with alkali followed by treatment with thionyl chloride provides acid chloride derivative, and condensation of acid chloride derivative with diethyl amino ethanol gives caramifen. Summary. Cough is one of the most common symptoms encountered in clinical practice. There are many over-the-counter combination syrups available for the management of cough. These are the mainstay of therapy in case of non-specific cough and may act as adjuvant in addition to treatment of the specific cause in case of cough associated with other conditions. Since a long time, expectorants and antitussives have been used in the management of cough with certain benefits. In this module, we have taken a look at the commonly found antitussives and expectorants along with their synthesis. With all these information, here we come to the end of today's lecture. To keep in mind what we have discussed today. This is time for your self-study. If you want to learn more for enhancing your knowledge, you may log on to our website, which is www.cec.nic.in for MCQ, quiz and LORs. Till then, keep studying. Goodbye.